I'm Dr. Blaze, and I'm glad to be back again to talk to you more about weight loss and fasting and some great things. I have patients that are concerned about how they'll be able to transition off of weight loss medication after they've lost their weight. The whole goal, of course, is to be able to sustain weight loss and continue to achieve your goals, specifically your health goals. And so one of the tools that I want to give you for your transitioning process, one of them, is going to be intermittent fasting. I think we've heard this terminology over and over again, and it's like was just so popular before Ozempic and all of the GLP-1 drugs came out. I just wanted to help you understand it a little bit more and why it is effective and how it kind of correlates to why the Ozempics and the Mounjaros and all of the GLP-1s are so effective. It has a lot to do with the blood sugars and insulin, right? We want to keep the blood sugars normalized, and we are carb eaters and we are sugar eaters, and we love it, and we love a little bit of alcohol, we love a little bit of wine, but we have to understand what that does to our bodies. Consuming high calories and carbohydrate kind of reverses everything that we're trying to do. But you know, YOLO, right? We're trying to live our lives. But I want you to understand how you continue to or can continue to reach your goals and understanding the blood sugar. And so when we go to fasting, there's different types of fasting. You also have a 5-2 plan where you consume 500 calories, let's say Monday and Thursday. You don't want to do consecutive days, but alternating days where maybe 2 days out of the week you're taking in 500 calories. Also, you have diet where you can 5 days out of the month, consume 1,000 calories or less. There's different ways to approach it. One that's very popular, of course, is the time restricted, where like about 12 hours out of the 24 hours, you're allowing the bowel to rest. You're decreasing inflammation with fasting. It also has cardioprotective factors, neuroprotective factors. It helps to build the autoimmune system. One of the great things that fasting does is it increases your growth hormone. And that basically helps you to burn fat and increases your metabolism. So we want to sustain this normalized blood sugar, and we can do that and control a lot of that, not only through fasting, but our decisions and our choices around food. And so food is very important. Our success doesn't just come from the medication, but it's kind of understanding everything. And that's what we, want to educate you with Reset. We don't want you to 100% rely on a medication, but saying, okay, well, if my consumption is this, what can I do 2 days out of the week? How can I reset the metabolism? How can I make different food choices? Daniel's fast is a fast that's done as a religious fast, also shown to be very effective because you're taking in plant-based foods, right? You're eliminating sugar, you're eliminating those carbohydrates. So I want to make sure that you are successful in your transitions because our mental state and health is so important now more than ever. And, we want to move away from the things that are giving us anxiety so that we can also improve our sleep. So knowledge is power. And so I want to empower you with this information so that you can transition successfully or just be successful in your weight loss journeys.